Hey guys, welcome to another episode of Darshan Talks. I'm here with Raymond. I'm going to let Raymond introduce himself, but we're talking about the SOS conference, and we just both came from it. I've spoken to him before, and he's amazing. We're going to talk about how that reflects into what we just did, and we'll go from there. So, Raymond, first to you.
Thank you. So, Raymond Nomizu, I'm the founder and co-CEO of CRIO. I used to be a clinical research site owner operator, and in around 2015 is when I got so frustrated with the challenge of running a research site using antiquated software tools and Microsoft Excel and paper and all kinds of access folders and all that stuff that I had this idea that we could really streamline clinical research if we could give sites a really good modern web-based tool. And so that was the genesis of CRIO. We're largely known for our eSource. We have a full CTMS, eReg, patient stipend, basically a full solution suite for research sites. And our solution enables protocol compliance, data quality, and tremendous amounts of efficiency.
We were at SOS together. What was your take from SOS? I know you didn't attend so many of the conference sessions because you were in there talking to the people, but to the extent you either attended it or outside, what was your feel?
I thought it was a great conference. Very high levels of activity and engagement at our, essentially we had a booth there. We had a double booth. We had gone there last year and it was amazing. It was more than we expected given it was the first year of the conference. So I could see it being a very, accessible and helpful conference for independent site owners in an industry that, is changing in some ways. There are definitely some challenges on the road on the horizon for everyone. Rise of technology, the rise of site networks, sort of changing sponsor expectations, a whole bunch of issues. And it's important for site owners to keep up to date on what's going on and, continually sort of improve your own operations, whether that's software or process changes or staffing changes or what have you.
We had Brooke from CRIO on right before the conference started, and she was telling us how to do conferences right and be strategic, be clear about your audience. My question for you is 2015, 2025, things have been changing. What are the new trends you're seeing going forward that CRIO is going to proactively address? And how does SOS help you address those incoming changes?
Yeah, I think the big changes on the research site side is I think there's going to be ongoing increase in site networks and I guess consolidation. I think that's inevitable. I mean, I wrote essentially a book back in 2018 called The Rise of Site Networks, predicting that this would happen because I felt that the fundamentals of the industry lent themselves to this. I do see ongoing roles for DCT hybrid, different delivery mechanisms, but nowhere near the sort of the hype that was there during the pandemic. And then on the sponsor side, I see a number of trends which we are starting to tap into, and I think we're getting a lot of interest from sponsors. And I think there's a number of things that are converging. One is sponsors are really buying into the value of real-time data collection and access to data at the source. So the kind of the old model was sort of EDC centric and everything went to the EDC and the EDC is a large secondary data clearinghouse. And now an increasingly high percentage of the data is coming outside of the EDC, direct from the patient, other data modalities. And I think this has really spurred an increase in sponsors, the value of getting real-time access to data. And then on the sponsor side, I see a number of trends which we are starting to tap into. And I think we're getting a lot of interest from sponsors. And I think there's a number of things that are converging. One is sponsors are really buying into the value of real-time data collection. I think we'll see an increasing adoption of the central eSource model. And I think that in turn will also sort of validate and further amplify the trend of sites adopting it locally. But I will tell you, there's still a lot of sites out there that prefer paper. It's kind of surprising to me.
DCT hybrids. I 100% agree with you that DCT will continue to come out. Here's my problem. DCT is the most recent blockchain. It is the most recent patient centricity. It is the most recent risk-based monitoring. they're just these trends that, quite bluntly, private equity wants to fund, so people are building so that we get to have a new trend that fuels another set of innovation. The truth is, in the end, research will continue to do what it's doing, and it will reflect what the doctor already does. The more hurdles we add in front of a doctor, they're just going to either ignore them or not do them, and you're going to have non-compliance. So while DCT will continue to rise, my concern is going to be more, is it really going to be called DCT at all, or will it just be called research and healthcare, which is what it was?
I think it's going to be just called the research.
Yeah.
I mean, there's so many different things that go under the DCT rubric. Like you could have a virtual site. You could have home nurses visiting the patient's home, complementing visits to the clinic, right? You could have centralized recruiting models, which are sometimes called DCT. You could have pharmacy chains being called DCT, but to me, they're just a clinic.
Exactly.
Different kind of clinic. So there's so many different variations of it. To me, they're all just going to be part of the research arm. And people are moving away from DCT right now anyway as a label because it was overhyped.
Correct. I've worked with a bunch of SMOs over time, a bunch of site networks over time. It tends to be that every doctor thinks that they're right. And every doctor wants it to be the way they do things, which is fine. But that makes doing anything at scale really difficult to do. If that's true, you're never going to see the efficiencies that a site network is promising.
I think if people just buy a bunch of different sites and gobble them together and put them under the roof, that is not going to create efficiency. I mean, the only way to do this is to centralize them, right?
Yeah.
So, how did healthcare become centralized? Well, the doctors sort of moved.
We call that hospital.
They ran the show to become employees.
Right.
And there's a whole new generation of doctors now. That's all they know. They work in the health system. They're employees, and they have a very different mindset. And I think, that's going to spill over to the research, end of things. So I think some site networks are doing a better job than others, standardizing delivery models and enforcing that. Because the more you standardize, the more you can centralize. And when you look at things like BD and finance and source design, e-regulatory, and even EDC entry, there's so many functions that can be centralized. So the name of the game to me is to standardize and centralize as much as possible. But then what you want to localize is the clinical team, right? The investigator and the CRC and their relationship with the patient and their actual, on the ground data collection. Those are the things that you have to stay local, right? But you want that to be as small as possible, small but mighty and powerful, right?
Correct. I agree with everything you just said. We've gone down a bunch of different paths. SOS has opened some of those conversations. Raymond, we're gonna have to keep talking because this is super fun, and thank you for having this conversation. I know everyone in the industry knows this, and it's literally right behind you when you look on the screen, but how can people reach you?
clinicalresearch.io. And my email is raymond@clinicalresearch.io. Really simple.
Thank you again, Raymond.
All right, thank you.
Call, click, or email.